do a test on me to check my arteries. Tell me, Steve, what your title is with the University of Utah.
I'm the technical director of the vascular lab at the University of Utah and also a research associate with the Division of Vascular Surgery.
And you come up here to Cache Valley Specialty Hospital to do testing, screenings. Tell me a little bit about that.
Right, we come up about once a month. I come up with Dr. Crace, and Dr. Crace sees patients first and then refers them over here if they need our examinations. And we can then look on the inside of the arteries and veins of these patients that he's seen and see if they have plaquing in their arteries or if they've got blood clots in their veins, that kind of thing.
And this here is an ultrasound, right?
Yeah, this is a high-resolution ultrasound, and this allows us to look right directly on the inside of the arteries and veins of patients without any x-rays, without any pain.
And it's very nice.
Yeah.
A lot of people think looking in my veins, that sounds scary.
Yeah, so no needles, no pain, and so it's a great way.
And we're going to do that with me right now. I'm going to lay down, and you're going to check my veins and see if I have any, what are we looking for?
Well, we're going to look to see if you have any plaque buildup on the inside of the artery. So we're going to look on the inside of this artery and see if there's even the earliest beginnings of plaquing that's building up. You know, you're a young person, so it's unlikely that you'd have big plaques. But this will allow us to see if there's even the earliest onset of plaque building up on the inside of the artery, so we can give you early warning if you have a problem. And then you could take steps to mitigate that by medications and lifestyle changes and things like that we can intervene with early and keep you from having a stroke later on in life.
And I have a family history actually of heart problems, heart disease, strokes, heart attacks, all of those things. So it's probably very important if you have a family history to get in younger, right?
Right. You're just the right person for this screening because you're the person that we might find something on. So yeah, let's take a look.
All right, let's take a look. So I'm going to lay back down and then we'll just interview this way.
So we've already got some gel on you, it looks like.
Yep, got the gel going.
We're going to look at the screen over here, and let me show you what's going on the screen. This is the skin line right up here. We've got the ultrasound. We're shooting it down into your neck. And this big circle down here is this jugular vein, this big vein that takes all the blood out of your head. All the rest of this gray stuff is mostly muscle tissue. Underneath this big circle that's that jugular vein is the carotid artery, and that's the one we want to look at right there. And they look like circles here because right now we're looking down the barrel of this vessel just like you'd look down the barrel of a gun. And if I continue to move up, I'm just scooting the transducer up your neck, that artery that was one circle is going to split into two. And that's where this big carotid artery splits into two separate vessels. This is going to be the internal carotid, it goes to the brain. This is going to be the external carotid, it goes to the face and scalp. But let's go back down a little bit, and then I'm going to turn sideways so that I can see the artery from the side. Now, when we turn so that we can see it from the side, it's a little bit easier to see and make out as an artery than it is when we were looking down the barrel of it. And when we look at this, you can see the artery here, and this little white line that you can see, that little teeny edge right there, that's called the intima. That's the important thing that we're really looking at here, is we want to be able to see that intimal lining. Plaquing, what happens is fatty materials that are circulating in the blood actually migrate across and get stuck in between that inner and middle layer of the artery. So plaquing isn't something that's sitting on the inside of the artery like people think. It's actually stuck in between these two layers of the artery itself and the artery wall. So with this technique we can actually see that lining and see if there's even the tiniest bit of buildup there real early. So I'm going to put a little more gel on here. This gel just makes it so that the ultrasound doesn't have to go through the air when we look at you. So I'm going to get back onto that artery. And this part of the artery is perfectly clear. You can see that white lining nice and smooth, and that looks good. I'm going to bring color on that will let me see the blood flow as it goes through that artery. And so you can see the red is the blood shooting through the artery. I'm going to just adjust this a little bit. And then the blue up above that is the blood coming out through that big jugular vein. Remember that great big vein that we saw when we first started. So that's what the blood flow looks like, and we can look up and tell a whole bunch of things by just what that blood flow looks like. We'll also listen to the blood flow.
Sounds just like a heartbeat right there.
So that's the sound of the blood moving through that artery. Each time your heart beats, it's pushing blood up through that artery, and that's what makes it so that you can hear that kind of a sound. Now we're going to come up to an area that's called the carotid bifurcation. Carotid bifurcation is the area where we're most likely to see buildup on the inside of the arteries if it's there. And so this is where plaquings usually occur. And we can see on you a little bit of plaquing right here. I'm going to try and get a little better view of that.
And it looks like I have a little bit of plaquing. Not good.
Yeah. So let's look around a little bit and see what that looks like. I'm going to have you swallow again for me. And so this is this little teeny bit of plaquing that we're seeing. This is right at the area where the artery is going to split into two. This artery is the external carotid artery that goes to the face and scalp.
Okay.
And then this is the internal carotid artery. This goes to your brain. And there's where that little bit of plaquing is. See that little teeny bit right there? I'm going to zoom this in just a bit so that you can see that. So see where this little teeny area of whiteness is right here. That's where that intimal lining is raised up, and underneath is a little bit of fatty material that's created a plaque at the origin.
So it's important at any age to come in and get screened.
Yeah, it's surprising, you know, when you see young people, you think, oh, they're not going to have plaquing, but this is exactly why we do this kind of screening. So you would be someone with your family history, and the fact that we're detecting a little bit of plaquing on you.
Well,
you're the person that we would want to take some extra measures to keep you protected.
Well, thank you so much, Steve. I appreciate it. And get in and get screened here. You guys are here once a month, and I appreciate you so much.
Thanks, Rick.